I'm Dr. Robert Tyrrell, and I'm an interventional radiologist at Dayton Interventional Radiology. When people hear interventional radiology, a lot of confusion is typically generated. I recall talking to my own mother, and it took me years to convince her as to what I did. She kind of knew what radiologists were, those guys that kind of read x-rays and have all the view boxes in these dark rooms, but she wasn't really sure what the interventional part was about. So in truth, I am a radiologist. I went to Case Western Reserve Medical School, stayed on at University Hospitals, did my 5-year residency there, and then did an additional year fellowship at the Cleveland Clinic Foundation for my interventional. And what does that mean? That means you are an imager, you're an expert at CAT scans, MR, ultrasound, but then you utilize that same imagery and do procedures. It's, I think, very fortunate that we're first of all imagers and then sort of secondarily surgeons and combine the two. I think of a case in question here. There's this one young woman, had a history of cancer, was treated with tumor-free at that point, and she was having this abdominal pain and no one was sure why. And we saw her in consultation. I said, well, send her imaging with her. And looking through all her images, I said, you know, she has a blood clot in this one vein. It's called the supramesenteric vein, which is one of the main veins draining all the bowel going towards the liver. And that can cause, just like stepping on a garden hose, a lot of congestion in the bowel. And I think that may be a reason why she's having pain. And I said, well, how can you treat that? And one of the other things I think we tend to be as interventionalists, we try to think outside the box a little bit. You know, how can we have a problem in front of us, we tend to be problem solvers. How can we do this? And we take all the other experiences we've had and all the other organ systems, you know, whether it's needle biopsies, drainages here, all the equipment we use, now we can reapply that to new situation. I said, well, you know, we could probably go through the liver. I can get a catheter down there. I can use medication that I would use in an artery, help dissolve that blood clot, and we'll see how she does. So we did that. Cleared the clot up, symptoms went away, no more abdominal pain. She did wonderfully. You're kind of a problem solver. First of all, when you see patients, you talk to them, you see what's the problem, you know, and we get all these referrals from all these different physicians that come in. So we look at the images, we look at the ultrasound, we look at the CAT scan, and then we see the patient, we bring it all together. And I think that's probably our biggest strength, to say, hey, this is what we can do for this patient, but we know how to bring that, all that information together, bring those puzzle pieces together and make a whole picture. And that, once we do, allows us to do the appropriate procedure for that patient. And that's very exciting for me. That allows us to do things that really other docs can't do.